To 3 health facilities in the Greater Accra region, including the Adabraka Polyclinic and also the Greater Accra Regional Hospital known as RIDGE. Here is the Kolebu Teaching Hospital, where we are trying to assess the impacts of the strike by the Ghana Registered Nurses and the Midwives Association. And one thing is synonymous with these 3 health facilities. That is, patients are stranded within these facilities. Nurses, there are no nurses around to attend to them. At the Adabraka Polyclinic, we engaged the medical superintendent at the facility, that's Dr. Abdul Razak Kwao, and he gave us details of what is really happening within the facility. He told us that the facility is currently short with nurses because on average they need about 40 nurses to operate on a particular shift. But currently they are relying on just about 5 nurses who are not part of the strike that is ongoing. And also they have made calls that they are looking at 3 nursing assistants to also come in to support them. At the Greater Accra Regional Hospital, also compared to last week where patients were not getting any access to health care, this morning the situation was quite different. Management of the facility have been able to put measures in place where doctors are now playing dual roles now. Whilst they are looking at playing their own or doing their own work, they are also looking at playing the functions or doing the functions of the nurses and the midwives. We engaged some of the patients there, and they also told us the issues that they are facing, and they pleaded with government to ensure that all that the nurses required are also provided.
Me de me brother na ba e bedu a 5:30. Be si sa time yen hwe. No mo se nurses for cause strike. Inti doctors for ne ba be hwe so mo ward nso still mo ma nipa bebrin ba kra ba yo mo ko. Inti esra ban se ne nurses for hia no nya mo na ye ba o matimi ahwe ese nipa nkwa ho hia.
Na de wo ha na mo de ba
Me nua ne ye call cardio na ye me ekotwa na koma nti one ne de ba ye.
Ene na yesenka mo ba nanka
se be hu doctor no. And they buy and so up to now, that's what you
and that's a baby. Right. So that's the situation here, a sad moment. So she came here with her brother who had issues, a surgery around the heart. That today they are supposed to see the doctor to review the situation, but they are not getting anybody to assist them.
I pay member last month, and I almost share me say member on the 9th. I didn't see me buy.
Nah, they are putting out the buy.
Makumaso, I say, Yarebo, Makumaso. Until me buy. Until me be who Akuma doctor. Until me buy, and I must say, one young buy, and tea and train. Until you go sweet train.
How many minutes? I'm not doing saying already.
I know, and your dream may be as a sea in a room. A sea in a room. Tea who next for no must say. International doctor no nyamba or baba and anything I buy.
Say be a 1 year nurses and I said doctors am on man show or baby I will call.
Baby I make you say me coffee. This is me coffee. But the last month and me yare me yofu mum na me ya. Nti my baby bia we say on be me surgery. And doctor say yare be dem akoma so. You say omukio yare na say no my surgery no. And no na kana me ba up and down since last month. Me ba up and down. Sunday we and my friend say member on the knife. And I have a draw. Yet it's one now. Say Dr. Nyam Bayon.
And I me ba review. I'm by so nurse for cause strike. Until now, this made my home make a grammar sorry coffee.
Now, how bad potty now what buy review no there and cow baby.
Me operation me con. Operation tika sabe me review ma me ba review last week almost say was strike, this week is almost strike. Say me nim da omo beba eno na me pese me hwe nya me dey but say me ba review na doctor who say me okay bamba ya just me san kofi
your name penny for doctors, I mean hospital managers na chochon kuma say o mama doctors for no astepi in ejuma esenka nurses for na ye na omo enye no doctors for na ba be monya ni ntie bisa obi aka be bisa
be there be abranti o yi card o se me kofi
card ni Kofi?
So many ho. Na doctors ni ho. Nurses ni ho nti omu ntumi nya adwuma. So nurses ni na ebo surgeons no. Na nurses ni ho. So Ajimi Kofi.
At the Kolebu Teaching Hospital, the situation wasn't different from this what we witnessed from the other facilities, but here there was a scene at the emergency ward based on the information that we've picked on the ground, where nurses, the senior nurses somehow clashed with the junior nurses because the senior nurses were trying to provide treatment, health care to patients that were already on admission. But the junior nurses won't allow that to happen. But the authorities also came in to ensure that the issue was resolved. And the information that we had is that at this particular moment, the facility is not admitting any patients again, but those that are already on admission, those that they've already been here for some time now, they are trying to provide treatment to them, healthcare for them, so that they can be discharged in the meantime. Also, when we got here, we also saw about 10 police officials over here. That the information, based on our interaction with them, what they told us was that they are here to assess the impact of the strike.
That is the situation on the ground. Believe it or not, one of the women you saw at that medical facility, I happen to know personally. What a coincidence, right? But that offer to defer the implementation of the nurses' conditions of service until next year has been rejected outright by the group, leading to some sort of labor impasse. The question, how do we resolve this deadlock that has left health facilities abandoned and also put patients in harm's way? Sweetie Abochi is right here with me, and we'll start with our guests.
Yes, so joining us via Zoom for this conversation, we have Senyo Ajabing. He is labor mediator and arbiter, ADR consultant. Sir, thank you for your time on the AM show. Let me start by asking, what systemic failures in Ghana's health financing do you think has brought us here? Because this is not the first time that we're dealing with a situation like that. So let's start the conversation from there. You have to unmute for us, Senyo.
Sorry about that. Yes.
Okay.
So, good morning. I wouldn't call it a systemic failure, but I think that in all relationships, including employment relationships, there would be these kinds of disagreements. And when these disagreements occur, there are laid down procedures that are used to resolve it. So to say it is a systemic failure may be too much of an issue or an overstatement of the issues. But I think that a lot of dialogue can and should be able to resolve this matter.
We spoke to Mr. Dr. Computer earlier this morning, and he said the challenge is that it is not this current administration that's negotiated these terms of service. And so that's a bit of a challenge because they're trying to understand exactly how to implement these challenges. Do you think that's enough reason why we are seeing this delay in implementation?
Well, no. Governance is a continuum. And so once there is a standing agreement, collective agreement, contract of employment, and an MOU, any form of agreement that binds an employer to an employee, then it's continuous no matter who comes or goes. And I also believe that there were transitional processes that would have revealed some of these pending issues that were supposed to have been resolved. And one would have thought that these could have been resolved in the earlier budget, but unfortunately it wasn't. But having come here, there still needs to be some form of consultation to resolve this. And the proposal to implement next year may be a way to go, or the parties can decide that they will implement but backdate the implementation. But to ask workers and worker unions to accept the postponement of their rights, the implementation of something that is rightly due them, would not be something that anyone would want to agree to. And that is why I believe we've come here.
Men.
Honestly, if you owe me something from last year and I'm coming for it and you say, no, let's wait, next year I'll pay you, but I'll pay you from next year and not backdate, then it's a problem. So I think that the proposals must be refined. There should be more consultations, and then I'm sure solutions can be found, yes.
You know, what comes to mind is banks and bad debt and how to handle those, especially with insurance and all of that. But this is pretty different in this context. Looking at, you mentioned the budget, looking at the approach this government has adopted so far in resolving the issue, one could have also said that they could have forecast that this would happen. It's kind of like single spine when it was rolled over. Has enough been done to forestall this?
Like I said, there were transitional processes, so I'm sure some discussions would have gone on, some consultations would have happened. But I believe that these have not been enough. I mean, in such labor relationships, a lot of consultation is needed. And we are not talking about just sitting around tables and meeting on occasion, but a roadmap daily, following deadlines, tracking, issues that are supposed to be dealt with, to make sure that both parties are on the same page in terms of the roadmap to implementation. Unfortunately, that I don't think enough has been done in that aspect. And that is why, as a matter of urgency, that should happen. Again, we need to put on record, though, that health workers are not supposed to undertake strike actions. So for me and some of us, where process watchers, where we sit, we believe that the approach may not be the best. It is like tying a person's hand behind him and challenging the person to a fight. So I think that we need to look at more prudent and lawful ways of reaching these consultations and agreements rather than going the unlawful way. Otherwise, then a good case becomes a bad case. And that is the only problem that we have. But beyond the legality, it is always a relationship. And the two parties have to commit to sitting down and resolving it. Otherwise, then we have lives on our hands, and people should, bow down their heads in shame if their actions lead to the death and the loss of lives. Yeah.
People should bow their heads in shame. Interestingly, the group has said, the GRNMA, the Ghana Registered Nurses and Midwives Association, they have said that if lives are lost, we should blame government. We are not here to play the blame game, but if you look at it, you've already mentioned that it is, so to speak, illegal for health professionals to embark on an industrial action. I do know that there was an injunction placed on them for about 10 days, so some interactions could happen, but they did not adhere to it. That's the legal angle. But if you look at it from the other end, this has happened time and again where professionals are given the short end of the stick and they have to get to this point. How do we find middle ground right before Sweetie comes in?
So this is why I like the new labor bill that is under consideration to be passed into an amended labor law. It prescribes stiffer punishment and penalties for breaches of the labor law. See, this is a case where both parties have offended the law. So
where both parties are what, government and the GRNMA?
Exactly, the employer and the employee. So you have the Ghana Health Service on the one side as employer, and then the union and its members on the other. Now, they have both offended the law. There is an agreement that is to be implemented that has not been done. That is a breach of the collective agreement. And then in trying to get the employer to pay, we have a union whose executives have taken the decision to breach the law and go on strike when the law says they are essential services and they cannot be on strike. While this is happening, an injunction has been placed. Well, we are not sure if they've been served or not, but that is on record to say that an injunction has been received or has been issued, and then they have to comply with these, but they are not, and they are still on strike. Some people, and it boils down to leadership in this case, and sometimes it's a bit frustrating where leaders do not act, and then, the ordinary person bears the brunt. We cannot start placing blame, but from where we sit as neutrals and process watchers, we believe that both parties are abusing the processes of the relationship, and these are affecting not only individuals in the streets, but also the economy in general, because healthcare is an activity that affects the economy, that affects productivity. And once we have a country to run, we need to make sure that we look for ways of preventing some of these things from happening. And I sound frustrated because I can imagine if I had an emergency right now, that a health emergency, what we'll have to go through. It's frightening for everybody. It may be someone today, but it may be you or me tomorrow. And so this has to be resolved, and we all need to insist that it is resolved. I believe the National Labour Commission is also in the picture, and some interventions should be made. There has to be a way of resolving this as soon as possible.
While we are looking at resolving this issue as soon as possible, there's another issue that our colleague, Collins Frimpong, brought to my attention. He said there's been some sort of clash between junior nurses and senior nurses in terms of whether or not to give care to patients. How does this affect their stance? Because you said that both parties, employer and employee, have already breached the labor laws, the ones that affect how they go about this. How does this affect their stance? If junior nurses are saying that let's not give care to patients, and senior nurses are saying, ideally, we're not even supposed to take industrial action in the first place. Let me know how this affects their stance.
So clearly, you see that there are some professional nurses of good conscience who believe that their leaders are not doing the right thing, and their ranks may be breaking up. And that is where the problem is, where there's weak leadership, because if a leader needs to get the right solutions to the problem that are faced, they do not go using the wrong tools or the wrong mechanisms that creates more problems for everybody. And that is where I have a problem with the union. A very good case that is being handled and resolved using wrong tools may not bring the necessary solution that is needed. The solution that is needed here is dialogue. The labor law requires that the parties sit, and even if possible, because they are essential workers, within 3 days of this dispute, an arbitration, a compulsory arbitration, should have been called by the National Labour Commission to resolve this matter, directives given, timelines given, and then implementation done. So I think that the posture of the union and its leadership is not helping the fast resolution of the matter. And if I were a health worker, I would think twice before also going on this strike action, especially if it offends the law. But hey, here's where we are now. We will need to still find a way of looking at the relationship, because it's going to be an ongoing relationship, and there are more issues to deal with on the table, and not only the collective agreement. There is also upcoming negotiations for wage openness and all that the relationship will have to undertake. So they have no choice than to sit around the table and continue looking at the options before them, and in the national interest, get a solution as soon as possible. But indeed, the monies that are owed have to be paid, and having owed, the employer needs to convince, the other party of a roadmap that assures them that the monies will be paid, and it will be paid to their work. Yeah.
Talking about a roadmap and fast resolution of this matter, the Labour Minister said he is shocked that the registered nurses and midwives have embarked on this industrial action. Does it come as a surprise to you? Because he's saying that there are various avenues for confrontation, and as far as he's concerned, they didn't exploit all these avenues before going on strike. Does it come as a surprise to you? Because this also falls under the Labour Minister's purview.
No, well, it doesn't come as a surprise per se, but we should all know that when workers are back to a wall, they would use the most potent means of getting their issues heard. And to have been frustrated to the point where they decide to go all out using this strike action, though as illegal as it is, then it should tell you that the relationship has really broken down to the point where both parties need to become more committed to it. Now, if you take, for example, the proposal that was rejected yesterday to say that I owe you from last year, May, but I don't have money to pay, so let's forget about everything and I'll pay you next year. I mean, nobody would accept this. This is something that is due me. This is my right. So there's no way a worker would forego such a right. So the proposals need to be refined, and those proposals have to be looked at in ways that assures and secures the trust of the other party, that's the workers, for them to be able to go along. So now we would need a more refined proposal from the employer, because as for the money, I believe it will have to be paid. One last thing I need to say, however, is that you cannot be in an illegality and be seeking a lawful solution. So once the workers are going after their rights, they need to be in the right. And so they need to call off the strike action and then go before the legitimate institutions like the National Labour Commission or even the courts to seek redress to the wrongs that have been done them. But I don't think that being on strike and demanding their rights is right. It cannot be that you would be on strike, which is illegal, and seek to come to the table and talk about something that is lawfully due you. So here are all the intricacies in the matter, but I believe that, hey, we can resolve this, and we need to do that very fast.
From my end, while these two elephants fight, the health service professionals and the Ghana Health Service, people are suffering. Some people may lose their lives in the midst of all of this. Since last week, we've been looking at instances where people travel from far away places, come to medical facilities because they have appointments, only to find out that no services are available. Someone I know personally went to Kolebu a few days ago and they could not get any assistance from there. They were turned away and they had to go to a private medical facility. So nothing that any one of us would want. But like you also say, he who comes to equity must come with clean hands. At this point, it would appear that the association is not coming to the table with clean hands. Can there be, and let me use another banking analogy, can there be a partial redemption? Because in banking, we also know that if there's a bad loan sometimes, or some loan that is not so viable, instead of a total loss in contract, you may look for a partial loss. Is there a way of finding middle ground between the two of them, rather than 2026 and all of that, and instead of also claiming definitely that we must start from May? Is there middle ground that can be negotiated?
Yes, of course. I mean, look, the options are many. But when you seek to resolve such an issue, you do not close down your options. You explore as many options as possible in the best interest of both parties. So yes, I believe that they can decide to meet each other halfway. They can decide to have a payment plan, and so on and so forth. But I don't think that it will be fair to ask employees to do away with monies that are due them and haven't been paid. If that will resolve the issue, yes. And if they can accept it, yes. But I don't think it will be fair to say that we have negotiated, we have agreed, we have in your collective agreement and contracts these benefits that are due you, but we are not able to pay. And so you should forget about it. I don't think that would be fair. But I am not at the table, and you are not at the table. When these parties have disagreements, they have to find their own solution within their own context. It's just like a marriage. They need to talk more among each other and think about what works, and then be able to resolve the dispute. So the options should be many, and the best, which is most suitable to both parties, should be reached. Not necessarily middle ground. There can be some compromises, but whatever is done should also be fair, because if it's not fair to one party, the dispute would rear its head in the future again, and the resolution would not be permanent. It will not be sustainable. So we need sustainable solutions through proper consultations to make sure that in the interest of both parties, the issues are dealt with, and then parties at least leave the table quite satisfied with whatever they got.
Let me just sneak this by you. What does this say about the proactiveness of the Fair Wages and Salaries Commission, the National Labour Commission, and maybe the general labor setup? I do understand it's early days still in this administration's first year, but what does it say about that? There was a point where you made mention of the fact that these things ought to be tracked. What do you make of it?
Well, we have institutions that in many ways are weak, and we need to, as governance people and as a country, start believing in strengthening our institutions so that they are able to do their work. I cannot understand why these interventions have not come more quickly, but I am most aware that most of these organizations and institutions are really constrained, and their structures make it difficult to be able to be that proactive and that efficient. So hopefully the reset agenda should also affect the labor arena, and labor stakeholders should put their heads together to make sure that we fashion out proper ways of dealing with these things and preventing them before they occur, because the resolution itself is more expensive than if we have to prevent them.
Have Mr. Philemon Japong here in the studio with us. He is Assistant National PRO for Ghana Registered Nurses and Midwives Association. So let's engage him and we'll circle back to you. Mr. Japong, welcome to the program.
Thank you.
Feel free to give us your initial reflections on how far things are going right now. But there's a point that I want to put to you immediately. We are hearing from Mr. Jabeng that, in fact, what you're doing is an illegality. As nurses and midwives, you shouldn't even be embarking on industrial action of this sort in the first place. And so if you're involved in such an illegality, how do you expect the government or whoever you're asking to respond to your needs to use lawful means to address your grievances?
Thank you, and thank you for this opportunity to address the good people of Ghana. If Mr. Jabeng will quote the labor provisions that speaks on these illegalities with respect to strike, I would want him to also avert his mind that nurses and midwives are essential service staff. And it is enshrined in the same Labor Act, in Section 162(1) of the Labor Act, that within 72 hours, when there is an impasse, the government or the employer must take steps to resolve these challenges or impasse so that it does not escalate into these actions we are seeing. Did they do the needful? If they are coming with equity, they must come with clean hands. Have they been able to hear out why nurses and midwives have taken this journey? And if they have, what steps have they taken to call the employer to order that conditions of service that has been negotiated and signed needs no further delay in implementation? So let's call a spade a spade. When something is not right, it's not right from the beginning. Let's not point the law when we are not abiding by the law.
Benjamin.
Mr. Ajabeng made mention of the fact that both of you are wrong, not that only you are wrong. Do you admit that, like you said, there are clauses that point to what ought to be done within some 72 hours? Do you admit that because of how crucial your service is, you should not embark on a strike? It's there before you, is it?
That is the more reason why we have not been embarked.
No, I want the admission first. I want the admission first. Do you
no,
admit that?
You need to give the opportunity for fair hearing.
I will allow you to expatiate on it. I am saying, what does the law say on that? Are you allowed to partake in industrial?
The law says essential service staff are not supposed to embark on strike action.
Okay,
so,
but this is unique, right?
But there are conditions that are prelude to that. There are conditions that will cause an essential service staff to embark on strike. We are in Ghana. Several essential service staff have embarked on strike. Doctors have been on strike. Health service workers, even mortuary people have been on strike. So
the coloration of even though. Hopefully
even to say that they are taking care of dead bodies, not to say they are not important.
Right. I see. And in this instance, we've been speaking to Mr. Ajabeng, and he's been pretty fair. He's a mediator as well, so he's looked at both sides. The 72-hour window, are you saying it was not met? There was no interaction within the 72-hour window?
Not at all. We stated this roadmap on the 28th of May, and the next communication we heard from Labour Commission, National Labour Commission, was on the 4th of June. That's way beyond the 72-hour window.
Which is basically 3 days.
No,
72 hours.
72 hours is 3 days, but Labour Commission got back to us after 7 or 8 days.
Exactly. So it was way past the 3 days.
Way past the days.
That notwithstanding, looking at the whole context of these terms, these conditions that were set up from sometime May last year, right?
Sure.
Until now. Between May and now, what was the roadmap really? I'm curious because it also feeds into what then implementation was going to be like.
All right, so let me just use this platform to bring clarity. Negotiation of conditions of service is not an instant situation. It takes time. So Fair Wages and Salaries Commission, which represent government, will send a message to us that your conditions of service negotiation is due. So bring a team together. We will also put together a team for government to sit with you and agree on terms. We started this process in January 2024. The communication started in 2023. And in 2024, January, we constituted a team, GRNMA on one side, and then the Fair Wages and Salary Commission, Ministry of Finance, Ministry of Health, and other stakeholders, like reps from the teaching hospitals on the other side. And these two teams met for months. And in each meeting, we table each item that wants consideration, that we want consideration. And they will decide whether they have the mandate or they have the capacity to take it on board as an allowance or not. And it will interest you to know that about 2/3 of what we submitted were shut down.
Were shut down?
Shut down with an explanation that there's Russia-Ukraine war, there's COVID, there is IMF.
Mean as of 2023, 2024, they were still talking about Russia, Ukraine, and COVID.
Exactly. And because of that, they couldn't take on board new allowances. And that's what we are even asking for. Let's say we asked for a uniform allowance we're already enjoying which they were paying just 400 cedis. We asked for 2,500 cedis to be able to sew 3 sets of uniform a year, because they paid once a year. And the employer team were not ready to take on board that package. They were able to negotiate it down to 1,000 Ghana cedi. For the
from
whole
400 to 1,000
cedis.
So you wanted 2,005. They said no, from 400 to 2,005 is too high.
Exactly.
They brought it to 1,000. Sweetie, just indulge me here briefly.
Yeah. So that is just a component.
Right. So essentially what you're saying is that they only accepted, out of even your request, about 30% were accepted. That's
exactly,
about 1/3,
exactly.
right?
That's about 1/3.
And out of this 1/3, I just want clarity before Sweetie comes back in. What was the roadmap from? Because as for the process of getting it there, but once you got there,
yes,
and pen was put to paper, yes, what was the roadmap in terms of implementation? Like,
all right.
When were you supposed to start seeing any?
When conditions of service are signed, the fair wages communicate to the employer, which is Ministry of Health, and then Ministry of Finance.
Right.
And Finance will put a covering letter on the agreed conditions of service and send it to Controller and Accountants General to pay the monetary aspect. There are monetary aspects of the conditions, and others are service conditions. These are conditional aspects, and those ones are not under the discussion here. The monetary aspect is what we are looking at. And these are allowances that needed implementation in 2024, July. So after May, when we signed, by July, the COS needed to be implemented from July.
See, I keep mentioning the Labour Ministry because I know they are the mediator-in-chief. And that is also under Labour Act 2003, Act 651, right?
Sure.
And apart from being the mediator-in-chief, they are also part in validating the legality and enforceability of any conditions of service. In this case, your signed terms of service that you already agreed on. At what point did you intend to bring in the ministry or the Minister of Labour into this? Because you've said that after 72 hours they didn't respond. You must have thought to escalate this matter because you had a mediator-in-chief who is empowered to even refer this issue to the Labour Commission before the industrial action.
That's correct. We had a number of meetings with the Minister of Health.
Yes.
And he kept assuring us that the conditions of service will be implemented. So we were not in a position to take the issue to Labour Commission when there is assurance that implementation is going to take place.
Please just clarify for me, when was the last such interaction with Kwabena Mintah-Kando, the Minister of Health, before the strike?
Before the strike, it was 28th of April.
28th of April.
This year, 28th of April.
Okay, please go ahead.
Yes. So the assurances kept us in limbo, whether to continue or pursue an action or to continue to trust what they are saying. And know that as executives or as leaders, we have thousands of people who are looking up to us and waiting to hear what we will say before they take an action. So we needed to go back to discuss with them that, well, the employer says we should give them time, and we have given them time up to this May or this April. So what do we do? And the council took a decision that up until when? We have had 5 meetings already, and we have given them 5 months already. So they had no more time to wait. And they called on us as leaders to declare. In fact, some of our specialized society even threatened strike before as leaders we had to.
But you see, Philemon, that is the point that I'm making. That there was a point that you could have gone to the mediator-in-chief and said that if we signed this,
we petitioned them.
We've been told, these promises were made to us, and we are in limbo, like you said. So come in and help us.
We communicated to Labour Commission.
No, I'm talking about ministry or the minute, because he said he's surprised, he's shocked by this action. That's why I'm bringing this back in.
He should not be shocked.
It means that there was no point where he was brought into the conversation.
In fact, if you listen to the way he sounds almost as though he had been blindsided.
Yeah,
or
this was
even
just sprung on him.
With this.
I'm concerned because that is the mediator-in-chief.
To the Labour Commission.
No. I'm not talking about Labour Commission. I'm talking about the Ministry of Labour.
Oh, the Ministry of Labour. Sorry, I was speaking the Labour Commission. Well, the minister needs to know that we are working in different facets. He, as a labor minister, must oversee the issues that happen in Labor Commission, in the Ministry of Health, and the Ministry of Finance. Were we supposed to go to each ministry to plead with them to implement our conditions of service after it has been signed?
Oh, but Philemon,
when they know that is the right thing to do.
Him.
Well,
would you agree that that was an oversight? That was maybe something.
Well, that's maybe an oversight.
Yeah, an oversight. Yes. Because he says he's shocked, and he is the right person you should have gone to escalate this.
We expected National Labour Commission to have engaged.
But it's the other way around. You go to the minister, and then he refers the issue to the Labour Commission. It's not the other way around.
There are structures of communication. Yeah. We could have gone to the minister, but not when our sector ministry has assured us that they are doing whatever is needed to get the conditions of service implemented.
Before Ben comes in, we are here, unless you want to stay on this matter, I want to bring up the issue of the clashes between the senior nurses and the junior nurses. I know it's not a good look, but do you see the wisdom behind the senior nurses saying that let's not follow through with this industrial action, let's give care to our patients?
That is an inaccurate.
Oh, a reporter on ground, Collins Frimpong, went to one of the places right here in Accra, and he reported that some junior and senior nurses were in some sort of clash as to whether or not...
Which facility is that?
Please check for me which of the places Collins went to.
The senior nurses are equally beneficiaries of these conditions of service. And if you are a manager, by the law, they are not supposed to, publicly come to join the strike action, which we share in that management portfolio. But that does not mean they should put impediments on the way of junior nurses. And it's not about junior nurses or senior nurses. These conditions of service for nurses and midwives. So I don't get that route. We are all supposed to benefit from the same conditions of service, and implementation is what we are looking for. So junior nurses, senior nurses, whichever category of nurses, are same in terms of these conditions of service.
But that means that not all nurses and midwives, I might add, are in agreement with this industrial action then?
Of course, you have a section of people not in agreement, but to best of knowledge and based on the research that we have done and our follow-up, about 99% of the nurses agree to this strike. And
so I've been told that he went to Kolebu, and that's where he reported on the clash in Adabraka. In fact, 3 facilities right here in Accra. And that's where he reported that there were some clashes between nurses as to whether or not to follow through with this industrial action.
We will find out from
Kolebu specifically.
Colleagues.
Yeah.
We will find out. But in Kolebu, you can check Kolebu. When we started the strike, there was total compliance. Probably a senior nurse is being coerced by management to put some impediments on the way of junior nurses, which is wrong.
Okay.
Yes, and that can be expected since the ministry is doing all they can to get this strike mitigated. And that is not the right thing to do. Let's implement the COS. Let's get the right people to do the right job.
Okay. I'll come back on how we unravel this impasse right now, but over to you again, Ben.
Are you concerned about some of these health professionals who are breaking ranks? You don't seem particularly happy. Are there any punitive measures if they break ranks? I mean, if they...
Breaking ranks as in?
Not complying with the industrial action. I mean, I say it from the standpoint of, clock sag, and the rest, sometimes they would say, we're on strike, and if you attempt, going to work sometimes. Yeah. I mean, you've been on the ground before, so you understand what I'm saying. In this instance, you don't seem happy about those who may be breaking ranks. Are you going to enforce any punitive measures against such?
Oh, not at all. We think that we declare strike in the interest of nurses and midwives in this country. And that interest is a shared interest. So we expect colleagues to follow suit and then fight for a collective interest. If an individual thinks otherwise, he has the right to remain at post. We are not coercing anybody to go on strike. And largely, almost all our constituents have followed suit. And they are complying with the strike directive.
If you had to give me a percentage, as far as you know, from where you sit, what would you say?
Say
I see someone sending me something here, but this person I can't guarantee, so I want to hear from your lips.
For GRNMA, it's a 100% strike.
100%.
And for the breakaway groups out of GRNMA, about 70–80% of their constituents have still joined the strike.
Let's talk about, you spoke about mitigating the situation, right? And just briefly, this would take time, wouldn't it? You spoke about the attempts, so to speak, by the health minister to mitigate the situation, and you say they are trying this and that. Maybe it's affecting your industrial action, but all of such engagements would take time, wouldn't it?
That engagement has not yielded much results. As a ministry, they are supposed to put in measures, but the right measures they are supposed to put in is to call on the stakeholders involved to get the implementation. Because for how long can you hold Kolebu or Ridge Hospital to ransom? And how many people can hold a fort for thousands of people who delivers healthcare, with special expertise? So I don't think these mitigating factors will last. And it's proven that the death toll or the disease burden is high. Lots of these private hospitals are getting filled up because of this industrial action, and we are not happy ourselves.
Actually, I can attest to that.
Like
There's
I
a
said,
private hospital I use. It was fuller than normal when I went. Yeah.
Over the weekend, I had to go somewhere else because, like
how
I said,
many,
they have been referred
Ghanaians
from.
Can afford, and how many more deaths or more casualties do we need to see before we address this?
Some people watching, I'm seeing a lot of messages, and some people are saying that is even more reason for you to temper, so to speak, justice with mercy.
My brother,
sense of what is happening, and some are also making the point that this was inherited. It's, if you look at the economic situation and what time, that's why I was bringing in the time factor, that maybe some concessions ought to be made along the line as government tries to resolve the problem.
All right. I think we have made concessions in the past. In 2016, we negotiated for conditions of service. It never got implemented. In fact, the Honorable Minister now was the Deputy Minister of Finance in the time. And our members were peeved. They called on us to declare a strike action. And we felt it was premature. Let's continue to engage. We engaged for 2 years. In 2018, we had similar issues. So in 2020, when we did a negotiation and we experienced those impediments, we declared a strike action. In 2020, it was even 3 months to election. And we don't really care whether it is Party A or Party B which is in power. But because of such, assertions that patients are at stake, people are dying, nurses must be humane. We have done that, and other caregivers have passed us in the healthcare continuum. They keep getting their conditions of service implemented, and their salaries keep increasing, whilst nurses keep staggering at a particular point, because when we negotiate as leaders, it doesn't get implemented. And when we declare strike, Labour Commission will go for injunction. Is that the right thing to do? And it's like they are tying our hands to our back and hitting our belly, which is not fair. And it has gone on for years. So nurses and midwives are now a bit sad. Let me use the right word. So when they get opportunity, they will travel to US, go to UK, go to Australia, where their service will be given the necessary compensation it deserves. We cannot pay the commensurate rate in Ghana. If people are taking $15,000 and the likes, we cannot ask for same in Ghana. But it will interest you to know that some cadre of nurses take home like 2,300 Ghana cedi in this day and age. Some have worked for 10 years. They are taking 3,900 Ghana cedi in Accra here, paying rent, paying transport. And all these allowances are part of allowances that we tabled that government shuts down. They did not consider it. So it's hectic and it's painful. to say that we are not humane.
So there are so many angles to this. You are getting the barest minimum of what you asked for.
Exactly.
And even that barest minimum, it's become difficult
to
give it to you.
Exactly.
On the other end, lives are being lost. On the other end,
and
government will tell you that, you know, they've also inherited. So the question I believe Sweetie and I have on our minds now is, how do we break the deadlock? How do we break it?
Well, I think this is to Ghanaians. Let's call on the stakeholders to do the needful and respect nurses and midwives. Let's give them what they are due. We are not asking for much. If you look at these allowances that I was talking about, they are just small allowances just to keep nurses happy at post. The same service that we render here, we render it as elsewhere, and we are branded best practicing people, best practicing nurses. Ghanaians go for competition abroad and they win best. You remember?
Naomi
won.
Yeah.
Exactly.
Yeah.
And look at, if I tell you Naomi's pay, you marvel. Specialist nurse, oncology nurse. And we have critical care nurses. What? Someone told me that, Phil, when I sleep, I hear the machines beating in my head. Because every now and then, a monitor is ringing and calling that some patient needs a certain kind of nursing care. And they go home with barely nothing.
Ben asked you what it would take, and he said this is to Ghanaians. We should call on our stakeholders to respect nurses and midwives. Hold for me. We're speaking to an ADR consultant. I want to get his thoughts on that quickly and then come back to you to wrap up. So, Mr. Ajabeng, are you related to Kizia Ajabeng? Mr. Ajabeng, this is what Mr. Japong is saying, that Ghanaians should call on the various stakeholders to respect nurses and midwives. What do you say to that? It looks like that is what they're asking for. Either you implement our terms of service or we continue this industrial action. What do you say to that?
I agree with him that the conditions that have been negotiated have to be respected. The collective agreement and its provisions have to be respected. But we as Ghanaians will also call on them to avoid using unlawful means of achieving the right things that they pursue. And that is where the problem is. You see, labor diplomacy requires that all means are used to resolve issues between an employer and an employee without resorting to any activity that or any action that affects productivity. So these are ways that should be taken, except that it is very easy for unions, even if the law does not allow them, to unilaterally decide that they would do what they want. And that is the challenge. In nation building, we need to all strive to do the right thing. And that is what they should do. They need to call off the strike action and then use the means available to push for a resolution. And you know, dealing with government is a difficult endeavor. The structure of government and governance is so huge that when you have issues and you are dealing with a party like government, it is extremely difficult. So we don't use simple and ordinary means to engage government to get what we want. You need to put all your best foot forward. And so I would encourage them that there are advisors, resources, consultants. There are people in here who know how to engage government, who can assist them to engage government to get the right thing. But there cannot be any justification on both sides to have even a single person lose their life because of such actions. And the law even provides for that. And one day, there would be a leader who would decide that they would properly implement the law against such actions that are known to be unlawful and illegal because it has caused death or it has caused certain losses. So I think that the right things should be done as he is advocating. They should also call off the strike and then engage to resolve the problem.
Are these words falling on fertile ground? Are you going to call off the...
Not at all. I think that Mr. Jabayan should apprise himself by saying that government should do the needful. We are calling equity here. We want to apply the law here.
He says government should do that, but he says you should also call off your strike. That's basically
You see, we didn't just come to this crossroad. We have gotten to the limit. We have been pushed to the wall where you table conditions, they are shut down about 1/3, which is about 30% are taken on board. And the 30%, you have been able to sign it off. And it's about implementation. And the government is very hesitant. There is no clear cut. We had a meeting yesterday with stakeholders, and they were talking about we calling off the strike action and then waiting for them to implement the conditions of service immediately with effect from 2026 January. Does it ring a bell in your ear?
There's something that just struck me. From where you sit, is it that you think the resources are available, but government simply doesn't want to budge? I saw someone send a message that, oh, if it were Article 71 office holders, they would have found money for their ex gratia. Is that how you feel? That
is how we feel.
The resources are there, but
that's
they don't
how we
want to.
feel that nurses and midwives have not been prioritized. Because we started engaging them before they read the budget. So if they tell us it was not factored into their budget, then where is the priority? Where then would we fall? Are we essential service staff? So what are that two? He was talking about negotiating with other stakeholders. Look, we have gone to the toll of the negotiation.
No. He said there are people who are trained, special like himself, ADR consultant, people who can lead these negotiations for you.
We have consultants, we have lawyers, we have other stakeholders. We have done backdoor consulting.
He's saying that they're specialists.
Have you done arbitration?
Yeah.
We didn't need to get into that because we were not in negotiation. It is when we are having salary and conditions of service negotiation, that's when we get into these lockouts. We are not negotiating. We are done with negotiation. So I don't know what it is for the employer to implement the conditions of service. When others are enjoying same, when others have theirs implemented. I don't know how you make it.
It's interesting. We're going to have to cap off the conversation here, but you would also realize, to be fair to government, that, Dr. Ikuya Mwako has been calling for the doctors, the clearance of their vehicles and all of that. I hear it would appear some things are being done, maybe in phases. And I guess I understand. That's the issue there. We have to go.
That's the pain. That's the pain. Where others are enjoying the same conditions of service we negotiated for.
Right.
And we are made to wait. It's 1 year down the line. The conditions of service will actually expire in 2026. So if you are telling us to wait until 2026, you are eventually telling us that you will not even work with it.
Thank you for joining the conversation, sweetie.
Yes, so this is Mr. Philemon Japong. He is Assistant National PRO for Ghana Registered Nurses and Midwives Association. And we also spoke to labor mediator and arbiter, ADR consultant, Senyo Ajabeng. And this is on the nurses. Thank you all so much, Senyo and Mr. Philemon, for joining us.